Imagine, if you will, a male patient. He's 220 pounds, he's visibly upset, he's throwing furniture across the room, and he's assaulted another staff member. The patient is physically forced to the ground by security, while a provider administers a shot of Haldol. This is an example of a violent and disruptive patient that we as nurses need to be prepared for. Today, I would like to share some useful strategies that will help minimize the use of physical and chemical restraints in our mental health patient population. I will cover a variety of strategies, including safety measures our nurses can use, de-escalation techniques, the importance of documentation, and the importance of an all-staff disciplinary meeting after a violent altercation. A few of the safety measures that we as nurses can use include clearing the room if we suspect a violent patient episode. We must also maintain a safe distance between us and the patient. If we can allow the patient a safe room to calm down in, that is definitely a useful strategy. A few of the de-escalation techniques us nurses can use include remaining calm and not using any argumentative or aggressive behavior. We can also simply ask the patient, what will help you right now? This simple question is very useful to the patient and can be very helpful. The patient must be given choices, and we must allow them to vent. As nurses, we must document the situation and participate in a handoff that includes mandatory attendance by the psychiatrist, the pharmacist, the social worker, and any other staff involved. The meeting of all these disciplines should take place shortly after the altercation and should include the triggers of the patient and what helped the patient calm down. The use of physical restraints must be avoided for several reasons. Physical restraints can result in injury to the patient and staff. They can also be very stressful to the patient and humiliating to the patient. It's traumatizing to use physical restraints, and it can harm the patient-staff relationship. The use of chemical restraints must also be avoided for a number of reasons. Chemical restraints can be so sedating that they prevent the patient from coping with their everyday life. Chemical restraints like benzodiazepines can be highly addictive and contribute to the patient medication addiction. Chemical restraints also interfere with the opportunity to learn new skills because they can make the patient so drowsy. I would like to implement these strategies within the next 6 months. And in conclusion, we reviewed some useful strategies to minimize physical and chemical restraints, including safety measures the nurse can use, de-escalation techniques, the importance of documentation, and the importance of an all-staff meeting after the altercation. My hope is that this will prevent any violent and disruptive behavior with our patients in the future. Thank you.